While all three tiers are less stringent than the national lockdown that we're all living in now, to keep people safe and to keep the gains that are being made, more areas than before will be in the top two tiers. This is necessary to protect our NHS and keep the virus under control. Turning to the tiers specifically, the lowest case rates are in Cornwall, the Isle of Wight and the Isles of Scilly, which will go into Tier 1. In all three areas, they've had very low case rates throughout, and I want to thank residents for being so vigilant during the whole pandemic. I know that many other areas would want to be in Tier 1. I understand that. My own constituency of West Suffolk has the lowest case rate for over 60s in the whole country, and I want to thank Matthew Hicks and John Griffiths, the leaders of Suffolk and West Suffolk councils, and their teams for this achievement. But despite this, and despite the fact Suffolk overall has the lowest case rate outside of Cornwall and the Isle of Wight, our judgment, looking at all of the indicators and based on the public health advice, is that Suffolk needs to be in Tier 2 to get the virus further under control. Now, I hope that Suffolk and so many other parts of the country can get to Tier 1 soon, and the more people stick to the rules, the quicker that will happen. We must make the right judgments guided by the science. The majority of England will be in Tier 2, but in a significant number of areas, I'm afraid, they need to be in Tier 3 to bring case rates down. Now, I know how tough this is, both for areas that have been in restrictions for a long time, like Leicester and Greater Manchester, and also for areas where cases have risen sharply recently, like Bristol, the West Midlands and Kent. The full allocations have been published this morning and laid as a written ministerial statement just before this statement began. I understand the impact that these measures will have, but they are necessary given the scale of the threat that we face. We'll review the measures in a fortnight and keep them regularly under review after that. I want to thank everybody who's in the Tier 3 areas for the sacrifices that they're making, not just to protect themselves and their families, but their whole community. And regardless of your tier, I ask everyone, we must all think of our own responsibilities to keep the virus under control. We should see these restrictions not as a boundary to push, but as a limit on what the public health advice says we can safely do in any area. But frankly, the less any one person passes on the disease, the faster we can get this disease under control together. And that is on all of us.